Hi, everybody. Welcome to Progressive Short Takes. I'm your host, Joe Firestone, and what I want to talk about in this short take is Obamacare, a problem once again. Now, from my point of view, Obamacare was always a problem. When it was originally passed by the Obama administration, it was the result of 1 year of fighting over health care reform. A wasted year which could have been spent on all kinds of other issues had only the President of the United States decided not to listen to the health insurance companies, not to listen to the pharmaceutical companies, and just passed H.R. 676, the version of Medicare for All that was current at that time. At that time being early in 2009. The bill could have been pushed through under reconciliation at that time. No compromise with the Republicans would have been necessary in that particular situation. Obama would have expended a lot of political capital doing that, undoubtedly. But it would have been great for the economy. It would have been great for people. Obama would have been a hero, and had he coupled that with an adequate stimulus bill, instead of the very small piece of change he came up with, he would have been a hero. And the Democrats would have won in 2010. And our whole history would be different right now. We never would have had Trump. From my point of view, Obamacare was always a source of grief. After it was passed, it was then a source of grief because it was the primary factor in the Democrats losing in 2010. Disappointment over Obamacare was a main factor in that campaign, giving rise to the success of the Tea Party. And adjusting to Obamacare over a period of years, waiting for it to come fully into effect until 2014, was another source of dissatisfaction with Democrats all through this period. Then there was constant fighting over Obamacare, of course, with the Republicans since that time. It wasn't worth the political trouble it caused. Certainly not from the standpoint of the Democrats, who were sort of hanging on to their role in the political system by their fingertips, always in danger of losing to Republicans because they neglected to pass a Medicare for All bill back then, and because they went to Obamacare instead. Well, it turns out that after all this trouble, Obamacare is still a problem. Let me share this article, which appeared in Jacobin. It's written by David Sirota and Andrew Perez, his colleague, at the Daily Poster. And the article is called "Obamacare is Becoming a Big Problem for Democrats." Democrats based much of their 2020 campaign on support for the Affordable Care Act, but the law has become less popular as the pandemic has exposed its flaws while continuing to enrich insurance companies. And you know about this caucus call, of course, that came on the Thursday after the election, but on November 5th. House Majority Whip Jim Clyburn warned that Democrats won't win the two potential Georgia races if the party's candidates run on, quote, socialized medicine, unquote. That wouldn't even have been an issue had Medicare for All been passed in 2009 when it should have been passed. But here we are, of course. It's now a problem because Jim Clyburn is still talking socialized medicine. And what Medicare for All isn't even socialized medicine. It's only socialized insurance, not socialized medicine. Even his new polling from Georgia shows that way more voters want access to government-run healthcare plan than the status quo. The disconnect between the Democratic leaders' views and reality spotlights a growing political problem. Democrats focused their 2020 election message on support for Obamacare and bashing Medicare for All. But the electorate isn't very enthusiastic about an Affordable Care Act that has failed to protect millions of people from a burgeoning healthcare crisis. And it's no wonder. Similarly, Joe Biden is promising a presidency narrowly focused on strengthening the ACA and helping the insurance industry stop the push for Medicare for All. Those pledges have likely helped to boost healthcare stocks since the election. But more and more data shows the ACA is not particularly popular among the voters who've seen insurers make huge profits while millions have lost their coverage. What is far more popular, according to polls, government-run healthcare. Now, in Georgia itself, Fox News polls from Tuesday's elections tell a very different story from what Clyburn is telling. Specifically, 52% of Georgia voters want the ACA partially or completely repealed, while 63% of voters support changing the healthcare system so that any American can buy into a government-run healthcare plan. The question describes a public health insurance option, an idea supported by both Georgia Democratic Senate candidates, specifically Raphael Warnock and John Ossoff. So both of these are to the left of Joe Biden on this issue. Those numbers roughly track the national figures. 52% of all Americans said in the Fox News poll that they want to keep or improve the law, while 71% want a change in policy that lets them buy into a government-run healthcare plan. How much more would they like if an alternative in that Fox News poll had been, how many of you want a change in policy that would provide you with a government-run healthcare plan with no copays, no deductibles at the point, of service? I wonder how many would want that. The Affordable Care Act support weakens as the law fails to protect people during the pandemic. Weak support for the ACA and much stronger support for a government-run healthcare program should not be surprising, considering what has happened in the decade since Obamacare passed. It's only been 6 years since it's been fully in place, by the way. In pushing the new program, Obama's administration dropped its promise to push for a public health insurance option while repeatedly suggesting the Affordable Care Act would at least guarantee Americans could keep their existing coverage. That assertion was always going to be false because the ACA preserved the employer-based healthcare system, meaning people can lose their plans with little warning if they're laid off or if their bosses decide to change the offerings. A situation that most Americans loathe, according to 2019 poll by Emerson. Meanwhile, many of the rosy promises about the ACA protecting Americans from insurance industry abuses have proven to be a cruel joke. Insurance companies still frequently refuse to pay claims and limit their provider networks, a situation that leaves people exposed to massive, quote, surprise, unquote, medical bills, even when they visit hospitals that are in their insurance networks. Now, during a hysteric pandemic, health insurance industry profits are skyrocketing as millions of Americans have lost their job based on medical coverage. For those fortunate enough to keep their insurance, premiums are eating up a bigger and bigger share of take-home pay. The new Kaiser Family Foundation study found annual premiums for employer-sponsored family coverage reached $21,342 this year, up 4% from last year, with workers on average paying $5,588 towards the cost of their coverage. And that does not include the higher wages that workers are probably foregoing because the employers have to pay for the rest of that $21,342 in order to cover the whole family. It's an enormous cost for the employers. If the employers didn't have to carry that cost, it would be much more likely that workers would be able to get higher salaries from their employers, higher wages. Who wouldn't want that? So that 5588 is a gross distortion of what workers are actually paying for this family health care coverage. It's got to be much closer to $12,000 a year if you take into account the wages foregone as a result of the current system. From the Kaiser study, particularly notable are the numbers in the age group 50 to 64, which is the demographic not covered by Medicare, but that uses more medical care than younger people. More Americans in that age group saw the ACA negatively rather than positively during the summer COVID burst, precisely the moment when more people needed medical care and were losing the health insurance that ACA advocates promised they would never lose. Meanwhile, Biden seems to be trying to limit the public option. He started off the campaign with a fundraiser with the Republican CEO of the health insurer Independence Blue Cross. He also declined to pledge to reject contributions from health insurance industry donors. At the same time, donors from that industry have made significant contributions to Democrats during the election cycle. Yes, contributions in the big millions of dollars. In the middle of that stream of cash, Biden said he would oppose Medicare for all as president. He said he instead supports a public health insurance option to compete with private insurance, but he has described his public option as a far more limited plan than the one on his campaign website. So he has one campaign on his website, okay, and Ossoff, okay, and also Warnock are probably running on that plan, but he's been saying something different. So the Democrats are hamstrung. Probably the two of them would probably prefer to run on Medicare for all if only Biden was for Medicare for all. What Biden has said about his option of late is, quote, it's only for those people who are so poor they qualify for Medicaid. They can get that free in most states, except governors who want to deny people who are poor Medicaid. So he said, quote, anyone who qualifies for Medicaid would automatically be enrolled in the public option. The vast majority of the American people would still not be in that option, unquote. So he's not talking about a public option for everyone now. Okay, while that's what Ossoff and Warnock are talking about. So they're running to the left of Biden on this. Anyway, a Democracy Corps poll found that voters reacted negatively to Biden's description. The survey, using real-time dial meters, showed a steep drop in support for Biden when he said his public option would be limited. Wow. I wonder if that's why the election was so relatively close. I wonder why the sweep that the Democrats were looking for did not occur. Could it have been because the Biden campaign backed off the public option that it had been promising? The government plan for everybody to get into if they wanted to buy into it? The government plan that is on his particular website? Perhaps even the Medicare for All plan now in the House that Biden might well have supported in the run-up to the election. If he supported that, what would his margins over Trump have been? How many Senate seats would the Democrats have gotten because that was Biden's program? I don't know exactly, but I think it would be many more than those we lost rather narrowly on November 3rd and the following days. So that's all for that particular progressive short take. Thank you for coming. I will see you soon with another.